Thank you. Yes, my name is Cheryl Tuttle. I am a current Associate Program Director with Emory University School of Medicine and their what I call Diabetes Training Academy. And I'm also a Reach Out community educator for what I like to call LDEP. It's the Emory Latino Diabetes Education Program. So from a CDE perspective, I agree that the reasons for non-adherence can be willing and knowingly, or maybe even unwilling. Is there lack of understanding, lack of instruction, lack of routine? What I'm finding is, you might hear comments in practice that I just forgot. I left my insulin. I don't like shots. I feel better when my sugars are high. I think what I see in practice is adherence really can be a balance of complexity of the treatment and perception of importance. I think that really can be a strategic element of trying to balance the two. As the complexity of the treatment increases, the adherence might be worse, and as the perception of importance changes, the perception of adherence might be compromised for a patient. So there's the very happy balance between thinking about what you're expecting of the patient and what they are perceiving as what they have to do in practice. When I'm approaching a patient, I like to think about how you could intervene in the sense of addressing the problematic beliefs with facts and discussion, discuss other potential barriers, maybe educate on the benefits of medication, and simply educate and ask the patient, find out where are they coming from and where does their category of adherence fall into. If it's okay, I would like to address some of the questions. One of the things that I would like to answer is how do we support Hispanic populations with adherence? I see that many Hispanics are very family focused, and I work to be culturally sensitive. And what I work with LDEP is having a bilingual instructor. That way we can be culturally sensitive. We have very culturally appropriate and approachable education materials, and we just kind of assure that literacy barriers are removed.
Thank you, Ms. Tuttle. We have a few more questions. So what are the key community linkages that health professionals can focus on to increase adherence for priority communities?
In the Atlanta area, I know for the Latino community, they really turn to the Latin American Association that has a health and a family-focused branch. Community linkages possibly could come from the Diabetes Association of Atlanta. When we think about what can increase adherence is education and unjudgmental resources that are from a non-stressful clinical situation for the patient. So the Diabetes Association of Atlanta and the American Diabetes Association can definitely be a great community linkage for having that down-to-earth relationship with the patient, and the patient can have a non-confrontational way of educating and asking themselves, what do I want to achieve out of managing my diabetes? There's also the Diabetes Community Action Coalition that is a partnership with Fulton County that really strive to provide access for resources for the underserved, prescription resources, and to really drive efforts to be a support system to let families and loved ones and people affected by diabetes, let them know that they're not alone and that they can, have a partner in their making decisions and helping them know that they are making the right decision and that they are not alone, but that they also can have a shared experience with making their decision and knowing that it's a right decision.
Thank you. Our next question, what methods have been successfully used in a community setting, ergo churches, school, workplace, community center, to help educate patients with diabetes?
Yes, two examples I can think of is from a social perspective, the library has been one way that I've seen community resources come together. For example, a diabetes wellness circle meeting occurs in Cobb County at I forget the name of the library, but they're a very successful resource, sustaining participants who come to the meeting. I also had a good conversation where, especially for the Latino community, they're very church-oriented. And I even participated in a very large-scale health fair with a Latino community focus that was based on a church campus. So I see some very successful ways of merging the community and using those community resources to be a way to eliminate some maybe perceived barriers to either the perception of not relating to somebody, or even something as basic as transportation. Those community resources can work really well.
Wonderful, thank you. Our next question, what are best practices for health professionals, community health workers, certified diabetes health educators in order to help patients with their fear of becoming insulin dependent?
Right, exactly. I would say, first of all, see where the patient is in their level of fear. If they haven't grieved over recognizing their condition, let them grieve and talk it out and accept the condition first. I think that's very important. I don't think you need to sugarcoat it either. You need to have a very open discussion, also asking about emotions and how you feel about it, but the practitioner needs to have a very open discussion about the basic facts of the progression of type 2 diabetes and the fact that it does create inflammatory damage of the pancreas, and often insulin dependence is a necessary target of treatment. But let them know that they're not alone. Let them know that it's not a sign of failure. Let them know that it's another, that it might be another challenge, but that you're going to be there for them and work them through managing another complicated treatment regimen. Encourage them to seek out support groups. If they haven't been in this, if they're going to start insulin, if they've had a life change, that's, one of the 4 guidelines for seeking out a first time or a second referral for diabetes education. Now's the time to seek out a diabetes educator and just support that you are going to send that patient to someone who has the time to talk them through it and to learn about what it would mean to become insulin dependent.
Thank you very much for an informative segment.